Hello, I am Dr. Fatih Dağdelen, an aesthetic and plastic surgery specialist. When discussing breast aesthetics, if we summarize it under three main categories, it actually includes breast enlargement, breast lift, and breast reduction procedures. We can discuss applications. Naturally, in addition to that, there are certain abnormalities in the breast known as congenital breast malformations. One side can be larger, one side can be smaller, there may be no breast, or there may be a burn on the breast, there may be tubular or tuberous patterns that we call goat's udder, there may be asymmetric structures taken due to breast cancer. We can come across patients. There are numerous different types of memes that are encountered in our work. There is an easy patient group within this patient group, which are really applications that many physicians can do. However, there are also patients with complex, serious problems, particularly these types of patients. There are instances where patients need to undergo a second surgery, which is referred to as a secondary surgery, after procedures carried out in clinics that lack adequate experience. And when it comes to breast problems, there is also a previously done. However, it's also necessary to mention a group of patients who have not achieved the desired result. Because breast is done very often, I would also like to mention that we are now encountering patients like this almost every day. Currently, we are placing implants in small breasts and decreasing the size of large breasts. How are scars formed? How do we create them? Actually, all of these, it is explained in detail in numerous programs, multiple videos, and by many of our colleagues. However, today I really want to have a conversation with you regarding certain unfamiliar matters, discussing tough problems. As I said, anyone can handle the easy part, but when it becomes difficult, physicians may not possess the ability to provide sufficient confidence to these patients. So what they're saying is that sometimes it's not enough to do it once, you have to do it twice. Or if the patient's expectations are high, when these expectations are not met, both the patient and the doctor can be victims in the end. Difficult breasts, asymmetric breasts, are difficult in themselves. Patients with developmental problems have never developed a breast or have excessively developed one. Breasts are difficult. Again, breasts taken due to cancer still fit into difficult breasts, especially previously completed a few times. Patients are once again patients who belong to the challenging breast group. It could be either a prosthesis, a lifting procedure, or a surgery for reduction purposes. This type of patients needs to be evaluated very well, planned very well, and operated by an experienced physician so that they do not have any problems again, and the patient does not have false hopes. I would like to mention that particularly sagging breasts, which also require lifting, are once again categorized as part of the challenging breast group. Reinforcement is performed in these patient types. However, if the patient's tissue is enough, a prosthesis should be added. In fact, you are employing two contradictory techniques in this situation. What do I signify? When you lift the breast, if you want a prosthesis, you can pull the breast down with a certain weight, something pulling down. Therefore, patients who undergo prosthetic implantation, both prosthetic and implantation surgeries, are really difficult. They are very complex surgeries, and in all conferences and congresses we have attended worldwide, as well as in the literature studies conducted, this issue is particularly emphasized by many of our colleagues, both in the world and in Turkey. Note that it's a controversial issue. Patients who've achieved good results need to know some of them are also limited to their own tissues. So you do it to a lot of patients, you get different results. You do it to a group of patients, you get completely different results. This is actually a bit of an unlimited thing with textures. Therefore, if you have this type of problem and if you are facing similar difficulties and if you really want your chest to give a good result, we are reaching the conclusion of the program by reiterating the significance and necessity of having the proper technique and making the right decision, which should be reflected in the outcome you have achieved. Looking forward to seeing you in our upcoming program. Thank you.